So, Assalamu alaikum, Dr. Meher. We are live in my group that is Empowered Women. And first of all, welcome back in my show. And thanks a lot for joining. And how are you today?
Walaikum assalam. Thank you so much for giving me a chance to talk on health issues again, Kiran. And I really commend you on hosting these programs, which are so important. I'm well, alhamdulillah. Thank you.
Okay, I really appreciate it. As you know, Dr. Meher, that I will begin with this. That you are noticing that we are having immense amount of raining this year, and with rain, we enjoy it. You know that its beauty, but it also brings a lot of diseases. So I would want you to just explain some of common diseases that comes with rains and people suffer with.
Okay. So you may have noticed that uh, recently the rains have become more intense and more unpredictable. Even in the predictable seasons like monsoon, the showers are heavier. So the lot of diseases are spread during these rainy season, and I will list a few, and then I would concentrate and talk on a few,
Right,
because in one session we can't cover all of them.
right.
So in areas which have a large population, we have seen that gastroenteritis and diseases of the stomach and intestine, such as diarrhea and gastroenteritis, are very common. And associated with them is also typhoid and paratyphoid fevers, which may have been in the community since long, but they become manifest more in this season. The other diseases that are common are due to spread of mosquitoes like dengue, because dengue is a viral disease, and it is spread by a particular mosquito which breeds in fresh water, and because of rain, fresh water is uh, stored in small pools and containers, and this larvae of these mosquito, they breed in these areas, and then they become more intense, and then they spread the viral disease dengue. The other mosquitoes that are bred also in due to presence of water are malarial, those that spread malaria, and that may also become rampant. And mm, a special disease known as leptospirosis is also seen in many areas of the world. And gastroenteritis and typhoid and paratyphoid are very debilitating diseases. We may have the human community have become sort of complacent in these issues. They take it as it is present, so it is not a burden. But people who suffer and who even die because of typhoid and paratyphoid are, like it's a great loss. And it may, according to statistics, a large number of people lose their lives because of typhoid and paratyphoid and diarrheal diseases, especially during the rainy seasons.
All right.
So
So, doctor, suppose out of all these, diseases which normally occurs in rainy season, especially. So, what do you think that which diseases are contagious, and when somebody would suffer with it, so then he should be isolated from rest of the family members. So, what do you think that some of the diseases they are contagious, and then people they should just take care of, like
Okay.
go in isolation.
So, but today I will concentrate upon diseases of typhoid and paratyphoid, because typhoid is usually endemic in the region, and it spreads from humans to humans. It is very highly contagious. It causes a lot of complication. It has a very high mortality rate. Many people die because of untreated typhoid. Then it is also chronic disease. It is in carrier state. So there are a lot of issues involved in public health because of typhoid and also paratyphoid fever. So today I will concentrate mainly on these so that people understand generally what it is all about and how to prevent and take precautions, and how to prevent disease spreading from one person to another. So, uh, mainly, typhoid is caused by a bacterium which is
Okay.
known as Salmonella typhi, and it is gram negative, and it is highly concentrated in the gallbladder and in the gut cells of the infected person. And the sad state is that it can stay in the gallbladder for years put together. The person can secrete it. So if he handles food and it is that food can be infected and it can be passed on to other people. So many people who are in the food industry, who are cooks and who are cooking, or who are doing as a bearer in service cook restaurants and food shops, they can spread this disease. The sad part about typhoid is it's a multi-system disease. It not only occupies place in the gut, but it can be in the joints. It can go into any. In fact, it can go into any part of the body and stay over there. So and cause disease of that area. So it causes high-grade fever. The patient can have intestinal perforations. He can actually have hemorrhages, and he can actually, he or she can, the patient can actually die of hemorrhage. So it's a serious disorder, and it should be treated properly. The sad part in the world is now um, typhoid fever is mm, resistant to many antibiotics, because lots of antibiotics were used without proper testing and without proper dosage. So, if you inadequately treat it, and a community resistance to that antibiotic is spread, so the disease keeps on spreading, and it becomes a nuisance for the community. So,
Dr. Meher, like about this typhoid especially, what do you think that would be, general or common symptoms that, people they can, have, and then, we can recognize that, yeah, somebody's just having typhoid. And do children also get affected with typhoid, or from which ages typhoid, somebody can have? So if you just can explain a bit about that.
yeah. So the symptoms of typhoid are general malaise. Then there is a fever. It's usually a step ladder fever. It starts usually with low grade fever, then it builds up to high grade fever. Then it happens that step ladder means that Earlier on, it's low intensity and it rises as the day passes. It becomes higher grade fever. Then patient can have chills, patient can have vomiting, patient can have diarrhea, patient can have severe abdominal pain, then he can have skin rash that is usually uh, can be on the abdomen, and some people also have herpetic blisters on the lips and around the mouth, and other skin rashes can be common in typhoid also. Then he can have joint swellings. If the joints are affected, then he can have abdominal fluid. If the abdomen is, then he can have patient can have hemorrhages. He can vomit out blood. He can pass blood in the stools. So there are multiple. I can even have comatose state. The patient can. General symptoms in kids are fever, a rash, and vomiting, diarrhea, and the fever can be very nasty. You know, it doesn't go away, and when you start treatment, it can gradually, if the antibiotic is suitable, then it gradually comes down. Uh, Children can be affected. It is very devastating for children to have typhoid because children have small bodies and they are overwhelmed by the infection then because the bacteria is very invasive. The
Mhm.
other type of paratyphoid fever are of three types, A, B, and C. So they are also quite devastating because they cause diarrhea, abdominal pain, fever, and they can cause severe dehydration,
Mhm.
especially in children. So it is very important to realize early that the patients are suffering, especially children. So it is very important to diagnose correctly typhoid. So a blood culture can be almost the most specific test because the Vidal test, which is a serotyping of the fluid, you can take the blood test, is not very specific. So even in cultures, it's not very easy to get very positive results. So you have to be very careful that the patient hasn't taken antibiotics in the 24 hours prior, and the patient is given proper blood culture test. But blood culture tests are the most specific for these fevers.
All right. Dr. Meher, first of all, for my viewers, if they, have any kind of questions, they can type in the comment section below. And suppose if the session would be over, so then I would just refer your questions to Dr. Meher, and she would definitely, would like to respond on that. So I want to know that suppose, like, when children, they get all kind of necessary vaccination for all the viruses, from their birth time, and they just take, especially if you say for the typhoid, I've also seen that there is a kind of vaccination that children they get. So then there could be an, like, possibility that after getting vaccinated for children and for people, they can also get affected with this typhoid, malaria, and other type of diseases. um, what is the reason behind, first thing? And is there any other reason also that may be of unhygienic condition that they can be affected with these kind of diseases?
So I would first, Kiran, I would like to emphasize that there are very simple measures people can take to for prevention of typhoid and paratyphoid fevers and all, and all such infections, getting such infections, especially during the rainy seasons, is one should always wash one's hands before eating or handling food. The other thing is always try and avoid eating raw salads and raw things outside of the house. Always try and handle food yourself and wash and clean the food products. Uh, Keep the um, meat and vegetables and cooked and uncooked food separately. Always cook food adequately, like meat should always be cooked properly. Eggs. Eggs are a very rich source of salmonella. So eggs should be cooked properly. Uncooked eggs and runny and raw eggs should not be eaten. And like I said, vegetables should be washed properly and should be handled by people who have their hands clean. The other important thing is always we have tried several times that all the clubs that we go to or the restaurants that we go to in Pakistan there is no such uh, laws for there are laws for food handling, but there are no laws for having screening for typhoid and paratyphoid of people who are working in the food and beverage industry. So these should be, I think, there should be a sort of awareness of that, and we should try and get people to get tested and not have these diseases. The other thing is that vaccination is very important. There are two types of vaccine for typhoid. One is injectable vaccine, and the other is oral, which is live vaccine. And these vaccines can be taken by adults and for children that are above 2 years. And usually the vaccine is uh, repeated after every 3 years. And it is very important to understand that vaccines are safe and they are, if there is any side effect, it may be mild side effect like fever or abdominal pain. But those effects are usually transient and they are dealt with by the doctor or the health personnel. It's very important to have regular vaccination. In Pakistan, we have a program with the National Institute of Health. They are producing vaccine, and they are also producing a vaccine which is concomitant with the cholera vaccine, because you may have seen in certain communities like in Haiti they had a very bad, and in African countries they have very bad incidences of cholera during rainy season also. But cholera is not present in all the places, but in some places it occurs simultaneously with typhoid and paratyphoid. So in Pakistan also they have a combination vaccine for that also. So it is important. In pregnant women, live vaccine is not given, so capsules are live vaccine oral. So, but then you have to see what is the advantage of if it is so much uh, uh, spread in the community that it is an advantage to give it to, and there is no choice, then it should be given. Otherwise, injectable is because it's a dead vaccine. It can be given safely. The other point I want to make
Okay.
is if some typhoid bacteria, salmonella bacteria, may be secreted by the uh, people who have been vaccinated, but that is not enough to infect the other person. So it is generally safe to have vaccination.
Okay, you mentioned earlier about typhoid and paratyphoid. So, can you please just tell this to my viewers about the duration of this a whole, disease? That for how long does it stay, and the treatment, and of course, like in regards for diet, that what things they should avoid in their meal when for the patients of typhoid, and for how long period of time. So
So
that.
the incubation period usually is from 1 week to 30 days. So you can be infected for a long time, and people don't know about it. Then the fever occurs and the symptoms occur. So as I told you about the symptom is the fever, especially step ladder fever. And in paratyphoid, you can have diarrhea, vomiting,
Mhm.
and fever. But the paratyphoid fever is generally for shorter period, and typhoid can take a very long time, and if not treated, is can be very very devastating. A patient can be killed by typhoid fever. People or children who die of diarrhea die of paratyphoid are generally children who are not treated for their dehydration. And people who die of typhoid are generally people who have intestinal hemorrhage because of perforations. Their gut wall perforates and they can bleed into the intestine, and that can cause death. So it is important to diagnose early whether it's a paratyphoid or it's a typhoid, and blood cultures are very helpful. And then the treatment is proper antibiotic treatment for a proper, like for typhoid, you may have to take the antibiotic for longer periods. For paratyphoid, it's for shorter periods, but it should always be under the care of a qualified doctor. Because the tragedy with this, why I've emphasized these two diseases is because a large number of people are suffering and lives are lost because of inadequate treatment. So, antibiotic treatment proper under the care of a doctor who has done the proper blood culture is very important in these diseases. And treatment of dehydration and diarrhea is again very important, especially for weak people, for children, for pregnant females. It's very important.
All right. Okay. And about diet, like in meal, what things or what food they should
Yeah.
avoid if you can.
So generally, we recommend a soft diet because in the intestines are affected, especially in diarrheal cases. You may have seen that people lose a lot of
Nutrients.
salts and a lot of fluid because of the diarrhea. So, a soft diet like khichdi, which is a meal of rice and pulses, which is soft, is generally recommended. Porridge you can take, and you can take soft boiled chicken and meat, very soft. Made into soft food, and mincemeat should be always done freshly and cooked properly. And we generally recommend pulses without husk, and cooked softly with uh, uh, rice and the wheat known as dalia, wheat porridge, soft. And in areas where these things are not freely available, you can use corn cooked properly, and you can use cornmeal, but cornmeal is generally hard, so you try and prefer millets and grains which can be cooked into a pulp and have a soft diet. You can take banana, and you can take curds. You can take make into soft cheese, and you can use that also. So that is my recommendation, and lots of fluid.
Okay. All right, thank you so much, Doctor. Now, if we talk about dengue particularly, and what I've just noticed, especially that in India, there's a big spread of it, of dengue especially. So, and I've also heard that that germs of dengue occurs of kind of, that's kind of particular black mosquito, and that leaves its germs in clean water. So I would want you to just give a little bit information about dengue, especially how does it occur, its prevention, spread, all about this in like a kind of short, brief manner. So then my viewers would like to listen.
Okay. Dengue is a viral infection which is spread by mosquitoes, especially, which has, this mosquito appears, it has stripes like black and white stripes. So, and it's a very fine kind of a mosquito, thin, and it is breeds very quickly on clean water. So, in the rainy season, what happens is when the rain falls, these areas where freshwater ponds are formed, or outside where there are any, like pots and pans, or and some open lids are kept in areas where the water collects, so it forms overnight. And then when it is bites uh, a person who is infected with dengue, and then it transmits the virus to another one when it bites the other person. So the transmission is also very quick, and it is a very quick. We call it vector-borne disease. Dengue is like malaria, a vector-borne disease. Vector is the mosquito in this. So the problem with dengue is that when dengue became it was there already endemic in many communities in Africa and South America, but it became quite uh, with the uh, environmental changes and with rain falling incessantly in different areas out of season, it became more common in other areas of the world. So in Pakistan, we became aware of it a few years back when it came in all the cities, and there was less awareness of it, and we understood that there should be a government program of training people, ordinary people, of using sprays to kill the mosquitoes, but also to understand that fresh water and pots and fresh water should not be stored, and it should be if stored, it should be covered with lids, and it should not be kept out in the open. And so there was a lot of awareness spread. Government teams were formed which helped the people understand not to store water, and also fumigation was carried out in areas which had a lot of population. So it was kind of contained and controlled. The treatment for dengue is symptomatic for fever, and the worst part of dengue is you have falling of platelets, which causes hemorrhages and which can be very seriously morbid, and also cause mortality. So, prevention of fall of platelets. So the platelets are given also, and then foods. Some foods are given to bring the platelets up, but that is mainly fresh green vegetables and fruits, which bring your immunity up. The problem with dengue is causes a lot of joint pains and bone pains, like the viral diseases. You may have seen in COVID-19 patient also complain a lot of with fever. They complain a lot of body ache and joint pains. So that occurs also with dengue. So it is the platelet depletion that is very, very serious in dengue, and that should be treated and prevented.
All right, thank you so much, Dr. Meher. We are running out of time, and I hope that this session would be so much insightful. So, thanks a lot for coming today, Dr. Meher, and lovely day. Bye bye from my side.